Hi, good day. My name is Germilyn Coleman, and I'm a resident physiotherapist at Granville Physiotherapy. And today I'm going to discuss about the effective assessment and treatment of shoulder pain and how physiotherapists manage and approach this kind of condition. About me, I'm a physiotherapist who studied at University of the Philippines, Manila in the Philippines. And I've been practicing ever since I graduated. When I moved to Canada, I've been practicing as a therapy assistant all the way to physiotherapist. So today, I'm going to discuss about shoulder pain. What are the assessment or do we check on it? How do we deal with it? How do we manage so that it would feel better and be best in its movement and function? So I hope you will learn on this webinar about how to assess and check your own shoulder, how to check shoulder pain, or if it's functioning 100% or efficiently, and how to deal, how to seek help so you could manage and do your activities of daily living and work proficiently. Shoulder pain problem. Any pain and discomfort over the anatomical part or area or during movement of the shoulder is a problem of shoulder. So one of the common signs and symptoms are pain. There is swelling. So there's a little bump that is not used to be there. There's discoloration or redness or bruising and all that, and there's warmth. The second important signs and symptom of a shoulder pain is limitation of movement. So if you can't do the full range of movement or the normal movement of your shoulder range of movement, then there's a problem with the shoulder. Also, there's a decrease of strength or weakness of the shoulder. So you could see it by changes when you're doing your normal activities, or like you would compare it to the other shoulder as well. So for the anatomy and movement of the shoulder, there are the bones that composes the shoulder, which are your clavicle, your shoulder blade, and your humerus bone. There are the muscles surrounding it. The main muscles of the shoulder are called the rotator cuff muscles, and there are like accessory muscles surrounding it to help those main muscles for the shoulder movement. They're also called the ligaments, which are the structure that connects bone to bone. So mostly these structures are not contractile, so they're like just taped there just to maintain the stability and the positioning of the bones. There's the capsule which surrounds the joint so that it stays. Only 1/3 of the humerus bone or your arm is connected to the acetabulum or the convex part of the shoulder blade. So it needs all these structures, especially the capsule and muscles, to hold it in that position, or else it's gonna fall. Aside from those, there's also called bursa, which are like the gel-like cushion of the shoulders, which protects the muscles against the rubbing on the bone. There are the nerves from your spine flowing to your arm. There are also the blood vessels, which compose of the arteries and the veins. Take note that when you look at the structure of the shoulder, there's only a small space where the main muscles are passing through. So it's a small passage or space. So any increase of volume there would compress, any changes of the positioning of the bone would compress or like impinge those muscles. The most common causes of pain are the muscle imbalances. So when one muscle is weakened, like for example, you keep using this muscle, so at the end of the day, it's kind of weak, stiff, or sore. Then the next day, that muscle can't function very well. So other muscle would compensate. So if you continue doing that, then there is called the muscle imbalances. So that muscle would be weakened, the other would be strengthened or overused. There's also called the shoulder instability. So the shoulder blade is supposed to stay in that position. So if it moves too much or it doesn't move, then it can cause some pain of the other muscles because of overfiring or overusage of some of the muscles. One of the important thing is posture. So we always try to correct the posture of our clients. So when we're too kyphotic or rounded shoulder, then the bones are also displaced or positioned differently than its normal position. So when these things happen, it can cause some impingement. So impingement is when the muscles, the end of the muscles, which are the tendons, are compress when you're doing any movement. Like for example, you raise your arm and you have like a kyphotic or forward posture. So you would compress that tendon. So when you turn your arm, like for example, opening a doorknob or like just getting something from your cabinet or your shelves, then you would impinge and kind of hurt that tendon. So when you keep doing this, when your posture isn't corrected, when the muscle imbalance isn't corrected, then you would develop tendinopathy. So tendinopathies are condition of the tendons, which are the end of the muscle. So you can have tendonitis. So it's actually just a swelling or inflammation of the tendons. Then if it's swollen, then you increase the volume. Remember what I told you, that there's only a small space which the muscles, nerves, and the structures passes through on that small tunnel of the shoulder bones. So when there's a swelling, and there's also increase of fluid there because of the swelling and inflammation, then everything's gonna get impinged. So when that happens, there's also might develop some bursitis. So the bursa are gonna get irritated by too much rubbing, so they would get swollen. So from this small circle, they're gonna get swollen to a little bit of like that. So it's not good because it may compress and affect the movement, the lubrication, the movement of the muscles. And when you keep doing it, the muscles, the swollen muscles keep rubbing the bone, keep being compressed, then you would develop some tears. Then it's getting serious because tears may come as partial to full. So what we don't want is for it to aggravate or to get worse. There are other causes of pain, like frozen shoulder. It is actually idiopathic. So idiopathic means it doesn't have like a direct cause. It just sometimes happens. Mostly you are at risk if you are older or if you have some history of shoulder injuries. The next one is arthritis, which is the degeneration of the bones. Usually it's the AC joint, which is here. So we're all doing, especially on your dominant hand. Okay, so it's rubbing between bone to bone, so heart to heart. So every time you move it, they would rub each other and destroy each other's surfaces, which promotes the osteophytes, which are seen on X-ray, decrease of joint space. So every time you move, it's gonna knock each other, grab each other. The others would be dislocations. If you have naturally hypermobile ligaments, then it would kind of dislocate, keep repeating on dislocation. So a little forceful movement would force the arm bone or the humerus to get out of its capsule. So there are different management for this as well. So fractures, like accidents, you will have fractures, you would have some surgeries that happen there. So those are the pains also that we deal with. Other causes of pains are sometimes systemic already. Like for example, if you have jaw pain or heart condition, sometimes you will have left or right shoulder pains. Shoulder pain comes from different causes that needs to be assessed well, so we know the proper management of it. Conservative management. So this is the PT way. Conservative means that we try to not use any invasive kind of approach, like the surgeries, the chemicals, and all that, not taking any medication. So in the PT way, we manage the pain. So we try to decrease the inflammation. We try to promote the healing. And then after that, we try to educate the patient, give them the appropriate and proper exercises for their shoulder pain. Activity modification is one of the most common during the inflammatory stage. Like for example, you're working and you already have shoulder pain and you try to endure the pain. So these are the things that we try to educate our clients. You have to respect the pain at some point, because if you keep doing it, the condition is just gonna get worse. And we try to stop from it to get worse. So we have to, of course, educate the patient so that they can improve the posture and maintain it that way. So we're not gonna let you just have that kyphotic or rounded shoulder and protruding head, okay, protruding chin and all that, because that would put a lot of strain and stress to your muscles and thus affect the proper movement of your shoulder. So we have to do all of that. We teach you the proper stretches, okay, for the muscles that needs to be stretched, proper strengthening exercises for the muscles that needs to be strengthened. So that's why it is very important that the PT, the physiotherapist, would see you for the proper assessment. So we have to know the problem on each condition. Okay, scapular stabilization. Sometimes we have to see if your scapula is on its right position or movement. We have to make sure that it's stabilized so that the movement of the shoulder can happen properly. So in the conservative management, we also do physical agents, so which compose of like the hot pack, cold packs. We use different machines like the therapeutic ultrasound to promote healing, decrease the inflammation, promote good circulation. We do have like our manual techniques as well to kind of guide the bones or the muscles, sometimes to release some muscle knots, taut bands, and all that. How can we really help with this? In summation, we have to make the assessment thorough. So we have to know the problem. We have to know what structure, what movement, what position, and what that's causing the problem. Okay, so we do a lot of tests to confirm and to make our diagnosis. We have to make some tests, like for example, we have to check the reflexes, we have to check the dermatomes or the sensation, just to see if, for example, your nerves are being impinged or affected. We have to see if the mobility of your spine is good, which can also affect the muscle movement. We have to do some tests just to see which muscles are the ones that are swollen, affected, torn, and not working properly. So we have different approaches for those just to have the proper diagnosis. So proper diagnosis means what is your main problem, which structures are affected. Because just pinpointing which the problem without any thorough assessment would be just like guessing what to treat and which structure is to treat. So we're gonna come up with your goals and my goals. So we're gonna come up with our goals to see at the end if we kind of reach the goals that we set. So the most important is we do individualized treatment plan, depending on your work, depending on your pain, depending on how you're doing. Every individual has different work, so combination of your work, activities of daily living, hobbies. So some people work like a cashier or an accountant, but they have hobby of like baseball or they do golfing. So all of those would come into one, so we could have an individualized treatment plan for those. So we try to evaluate or see every time you come in the clinic. We try to see the progression. Is it getting worse? It's still the same? Is it doing better? And at the end, once we kind of discharge you or every time you go home, you have to have your maintenance home exercise program. Okay, so we don't see you every day at the clinic. You don't stay at the clinic. So you have to have your own management at home and to help yourself manage the pain and for you to reach your goals very fast. So the other management, like for example, taking medications or pills, taking corticosteroid shots to decrease the inflammation, the pain, and some, if it's gotten worse already, there's an invasive ways like the surgical repairs. Fun fact, the shoulder joint is the most stable mobile joint in our body, which means it is the least stable and more prone to injury. So our shoulder joint is the most mobile. So it has lots of movements, but that also means it is the least stable. It's not only because it's the most mobile joint, but it's also because only 1/3 of the ball of your arm bone or humerus is attached to the capsule or the acetabulum of the shoulder blade. So if there's weakness, if there is wrong positioning, if there's like a forceful movement, it can just dislocate easily. 50 to 85% of cases are under rotator cuff tears. 80% can be managed by PT. So these are just the reference. Thank you. If you have any questions, you could call our clinic, Granville Physiotherapy. Everyone who watched this video can have a complimentary assessment. If you have questions, you could call me at the clinic. You could reach us there or you could email us. So thank you for listening, and I hope that you learned something from this. Thank you.